Welcome to sqadia.com. My name is Saima Mushtaq, and in today's topic of ENT, we will talk about disorders of vestibular system. We divided our lecture into 5 sections. In the first section, we will talk about some major peripheral disorders, and in peripheral disorders, we will talk about vestibular disorders specifically, and then Meniere's disease, benign paroxysmal positional vertigo, vestibular neuronitis, and labyrinthitis. Then in second section, we will talk about some other peripheral disorders in which we will talk about vestibulotoxic drug and head trauma, perilymph fistula and syphilis, and also acoustic neuroma. In the third section, we will talk about then some central vestibular disorders. And in central vestibular disorders, we will talk about vertebro-basilar insufficiency and Wallenberg syndrome, basilar migraine and cerebellar disease and multiple sclerosis. We will also talk about epilepsy, tumors, and vertigo. Then in the fourth section, we will talk about some clinical tests of vestibular function, which includes spontaneous nystagmus and fistula test, Romberg test, gait analysis, and past pointing and falling test, positional test, and test of cerebellar dysfunction. Then in the fifth and last section, we will talk about caloric test and electronystagmography, optokinetic test and rotation test, and also galvanic test and post-urography. So all this will be covered in today's lecture, Disorders of Vestibular System. So hopefully you are interested to learn more about this lecture topic. So keep watching sqadia.com.